Okay, and quick tangent. Can you just kind of give the history of cataract surgery and how it's probably the number one procedure out there, especially over the last 50 years. So, do you mind just giving your insights about how far we've come and how safe it is, just to kind of re reiterate that point?
Oh, of course, Ed. Yeah, cataract surgery was born in about well, it's been around for like thousands of years, right? You've got like
Okay.
the ancient Egyptians who, see the white cataract, they just poke it like with some trauma in the white cataract, just dislodge it, and then the patient can somewhat see, although they don't have lenses back then, so they're just kind of seeing like colors and shapes and whatnot. Um, Back in World War II, we had these fighter pilots in the Royal, Air Force that they got shot at, and some of the glass went into their eye, and they determined that, hey, look, the glass went into the eye, and it like does nothing. It just sits there. That doesn't cause infection, inflammation. It's very stable. So why don't we remove the cataract, like we've been doing for so long, and replace it with a lens inside the eye so that patients can see again. And so, they tweaked that over the last 80 years, from like a big surgery with large incisions to now just a minor procedure with no sutures and these.
Amazing.
Yeah, so it's come a long way, and we just in the last 20 years now we have the ability to correct for presbyopia, like Ed had said, the ability to see distance and up close all at once.
Great. And to tie into that topic is refractive lens exchange procedure covered by insurance? I know a lot of people think, okay, I have cataracts, or I'm going to wait until I develop cataracts to get my eyes taken care of by insurance. Like, what are your thoughts about that, Dr. Tien?
Yeah, that's a great question. So insurance is something that's available to all of us if we choose to wait for cataracts. Insurance has evolved such that it becomes more and more restrictive. As we all know, healthcare costs are going up, and there's only one pot of money for your heart, your life-saving heart stent. And cataract surgery, which is, to most people not as important as life-saving stuff. So for the average American patient, as it stands, insurance will only cover your surgery if you are no longer able to see better than 20/40. For most people, that starts at age 76 or so. That's just statistics from CMS. So uh, what we do in RLE is we move that time point up about 20 years. And the whole reason is, none of us really want to slowly go blind from cataract. And we want to enjoy our lives in our 50s and 60s and not be, stuck in class. We want to travel. We want to swim and fly and, not have to deal with glasses, misplacing glasses, feeling vulnerable, when you misplace your glasses and maybe there's like something in the shadows coming out towards you, you don't know what it is. Um, you never have to really deal with any of those inconveniences anymore. Anyways, ROE is not necessary. It's very elective. Even cataract surgery itself is elective. And I would say it's basically just a luxury. It allows you to have more convenience, more control over your life, not have to worry about certain things or certain situations. Um, Anyways, I don't know if that.
No, that answers. And that's why a lot of people come to us is because they're frustrated with wearing glasses.